Mr. Speaker, our government committed to the people of Ontario during the election campaign that we would fix our public healthcare system. Ontarians across this province have been waiting far too long for improvements to our healthcare system. That is why yesterday I was so excited to hear the Minister of Health deliver our government's long-term plan to fix and strengthen our public healthcare system by focusing directly on the needs of Ontarians, patients and families. Mr. Speaker, could the minister please update the members of this legislature on how our plan will benefit patients in Ontario?
Minister of Health and Long-Term Care.
Mr. Speaker, and I'd like to thank the member from Kitchener South Hespeler for her question and for her great work on many, many fronts. Thank you. This is an important issue. As we all know, our healthcare system is facing many problems. Patients and families are lost in our healthcare system, falling through the cracks and waiting too long for care. This has a negative impact on the health and well-being of patients and their loved ones, both physically and mentally. Right now, care is fragmented, particularly at transition points, for example, from hospital to home care. Patients, families and caregivers experience frequent gaps in care and have to reiterate their health care concerns over and over and over again because of a lack of digital tools and care continuity. It is clear that the value of our healthcare system is locked away in silos.
Response.
Most frustratingly, Ontario is home to some of the best doctors, nurses and care providers in the world, but they haven't been given the tools to do their jobs properly.
Thank you. Thank you. Supplementary.
Thank you, Minister, for that response and all the work that you're doing. I am so proud to support your plan that strengthens, again, our public healthcare system. My constituents in Kitchener South Hespeler are certainly going to benefit from patient-centred care going forward. Speaker, to me it is unacceptable that 1,000 patients every day across this province are accessing health care in hallways. I know that strengthening our publicly funded healthcare system will benefit both patients in Ontario and healthcare providers. So could the minister explain why else it is critical that we move forward with this plan to strengthen Ontario's public healthcare system?
Minister.
Thank you again to the member for the question. Mr. Speaker, I do want to make it crystal clear to the people of Ontario that our government is 100% committed to strengthening our public healthcare system. That's why, throughout our government's process of developing our vision for our healthcare system, I want to say directly and very clearly to every legislator in this House and to the people of Ontario that our objective has always been and will always be strengthening our publicly funded healthcare system and making our system better for patients, families and their caregivers. That means for the people of Ontario continuing to use your OHIP card for services as you have always done. That will continue. And I'm pleased to say that if passed, legislation is passed, we will finally be able to build a coordinated public healthcare system around the needs of the patients of this great province.